for the task, and you have only slide to go through, and
Okay.
your 2 minutes starts now.
Hello, my name is Dr. Madziwa. I'm one of the doctors in the clinic. Are you the daughter of Mrs. Maya Thompson?
Yes, that's me. I'm Erica, doctor.
Sorry, what's your name?
Erica.
Erica. Okay, nice to meet you, Erica. Erica, what can I do for you today?
I don't know. It's just that the care home people and the doctors in the hospital have given me a call saying that my mom is having this sort of bleeding after her menopause. But
Right.
but I don't stay with her anymore, doctor. I don't think I will be of any help for you today.
Oh, okay. So, right. Okay. So, do you know who's got the lasting power of attorney for your mom?
My father did have, but he's no more, so technically I don't have it.
Mm. Okay, so how then can we help your mom then? Do you have an idea of how has all her other treatments been going? Maybe you can help me from there so we can make a plan
Um,
based on.
but doctor, please make it quick as much as possible because I'm running late for my office.
Mm. I mean, I understand. I totally understand, but I really want to know, like, I really want to help your mom. I mean, if you can tell me what's been happening with all
Um,
her other
I don't know.
care so that we can use the same.
Understood. Yeah, I understood that it's her second episode of bleeding. The first time
Mm,
it was a kind of light and it was manageable, and this time it became quite heavy. That's what they told me. Otherwise, I don't know. I don't know much about it.
okay, so is is your mom able to come in with her care workers then?
She's admitted, yes.
She is admitted. And there's a question that I just really want to know. So how has her care been going? Who has been giving all the consent for the procedures and everything?
I'm her biological child. I'm the only daughter. You can take a consent. If you want to do some blood tests or investigations or manage my mom, you have my consent, doctor. You can go ahead.
And how's your relationship with your mom?
She used to stay with me. It's just that since 4 years, her Alzheimer's, it was out of control and it was advanced, and she was not recognizing me anymore. And
Mm-hmm.
I'm also a working woman, and things got worse, and then I had to keep her in the care home. But everything is being taken care of by the care work people, and they do take her to the specialist, the neurologist, and yeah, things have been going good with her. But it's just that she doesn't recognize me anymore.
Mm-hmm. Okay. Um, Fine. I totally understand. But if you've given us consent to, if you've been giving consent and you have given us consent, I could, if that's okay with you, I could discuss what we will be doing for your mom. Maybe you could give me a bit more background about her health, and then we can make a plan with you before you go. How does that sound?
Okay, all right.
Okay, so you've mentioned she's been having bleeding after the menopause, but how, and you've mentioned about Alzheimer's. Does she have any other medical conditions?
No, just that.
Okay, right. Is she on any medications at all? Do you know?
She's taking some supplements for her Alzheimer's. That's it.
That's it. Okay, has she had surgery before?
No,
Okay, and any family history of note, like cancers
no,
that
but
you know of?
is it a cancer, doctor?
Um, n- uh, well, I cannot say for certain now. Would need to do more tests before we know what exactly is going on.
Okay.
But it's always good to keep that at the back of your mind. And it's one of the things, cancer is one of the things we'll be ruling out with the tests that you've consented for us to do.
Okay.
Okay, so no family history of cancers,
No,
blood clots?
no,
No, okay. Is she taking any hormone replacement therapy? Do you know?
no.
Okay. Does she smoke or did she smoke or drink any alcohol?
She used to in her, I think, earlier 40 or something, but not now.
Okay. All right. And do you know your mom's BMI by any chance?
She's fit and fine. She's lean all her life, yeah.
Okay. Thank you for sharing this background with me. It will really go a long way in helping your mom. So when she comes in, we will examine her with your consent. And the examination will involve taking her vital observations just to see how her general health is doing, doing having a feel of a
She's
tummy.
very, but they said, the doctors, they said that she's not very cooperative. She's not understanding
Mm.
what you're trying to say. Is it possible to examine her now?
I mean, we can always try. If she's not cooperative, then that's fine. But we'll also need to do um, an examination down below. If she's not cooperative, then we would have to leave that and opt for a scan, find a way of doing a scan, and
Okay.
a pelvic scan to
Mm-hmm.
check the thickness of the lining of her womb.
Mm-hmm.
So that would be the first thing we would then do a scan to check the lining of her womb. Depending on what that scan shows, we'll need to do a small test that takes samples from the lining of a womb, which we call a people biopsy, send
Mm-hmm.
it to the lab. We may also need to do a camera test where we put a small telescope with a camera, have a look around the lining of a womb, and also take some directed samples or biopsies and send to the lab.
Oh, okay. But what are you looking for, doctor? Why is this bleeding?
Mm, okay, so we don't expect women who've undergone the change to be bleeding. So we're trying to look for any abnormal cells in the lining of a womb. As we talked about before, it could be cancerous, it could not be cancerous. So for us to know that, we need to take some samples, send to the lab. The lab will have a look and then tell us what it is, and that would guide our treatment options.
Okay, but what is
It
the
could,
chance of she having cancer?
um, based on her age. I don't, how old is your mom? Sorry, I forgot to
67.
ask.
67.
Okay, so the chance of her having cancer would be about 10 in 100, so 10%.
Mm.
Um, so which
That's
is
quite reassuring, doctor. That means the 90% of the people will not have cancer. Yeah?
yes. So but it depends. Yeah, 90% will not have cancer, but yes. quite well. I don't know if it depends on how you look at it, but there is a small chance that it could be cancerous.
Okay, so why are you waiting? Just you have my consent. You can go and do the test which you said. Just mention it to me.
Okay, so what I'll need to do, Erica, is I would need to have a discussion with a team of experts, my consultant gynecologist,
Mm-hmm.
okay, the Alzheimer's doctors,
Okay.
the scan doctors as well, just so we can make a plan. Because as you can see, it will need a lot of input for managing your mom. So
Mm.
we'll need a team of experts just to help with organizing her care, her examinations, her scans, and what to do next. Okay.
So,
Um,
do you think I need to come back again?
I mean, it's always good to offer your mom support, but I think it would be good to have you to sign the consent papers. Um,
Okay.
but but yes, so if
Mm.
you can, please, you can come back. And it's also good to have someone familiar to mom there for support.
Okay. Okay. I will let them know. Yeah.
Mhm. So depending on what the findings of the investigations show, the camera test and the samples to the lab, the histology, we will offer her management based on that. If it's just cells that are not cancerous, then we can give her a coil with your consent. We can put a coil in her womb,
Mm.
a hormone coil in her womb, which can help quieten the cells of the lining of her womb. Um, we can give her tablets, but it would depend on her whether she's able to swallow tablets. It all depends on her state and what you would prefer for mom.
Okay.
But
So, is there any consent form I need to sign at this point of time so that I can carry on with my work? I'm busy.
oh yes, you can. So I think first of all, let's get mom in. Let's examine. Let's see if she's fit for this procedure, and then once we've established that, we can always invite you back in to sign a consent, because it's, as you can understand, it's quite uh, tricky and difficult to make a plan without actually having reviewed the patient ourselves.
Okay. Time's up. Time to move on with the next task, Dr. Chido. You're okay?
I'm okay.
Okay. All right. Task, which was Alzheimer's. Yeah. Over to you. What do you think?
Ah. What sort of a station is this? I had no clue whatsoever.
Okay. So basically, Mental Capacity Act is being assessed, and there were a couple of recalls in the exam as well to understand your knowledge on the Mental Capacity Act. Yeah.
Right.
So here there are few buzzwords you need to remember. One
Okay.
is that lasting power of attorney, which you asked, and
Mhm.
then advance directive, whether her mom has given any directions in advance
Right.
about some treatment she would accept, not accept, when she was competent enough to make the decisions.
Mm-hmm.
Okay, so that's what you have to ask her, whether your mom has given any advance directive which is in place we can look into.
Mm-hmm.
Because few people would say that, oh, okay, I don't accept, sorry,
No
I
worries.
don't accept this sort of treatment. I would accept surgery. I would not accept the medical treatment. I would accept. So things like that. And
Mm.
second thing is the lasting power of attorney. So the doctor doesn't have the lasting power of attorney, and advance directive is not in place now. So how are we going to manage this particular
Yeah.
question? Because the daughter cannot give the consent. She can't
Mm.
sign the consent.
Oh, so she can't sign the consent.
She can't sign the
So I
consent.
have to go to court then.
You have something called as best interest meeting. Yeah, where the team of healthcare professionals, the MDT, your consultant, the counselor, and her daughter herself, and other people who are very close to Maya Thompson and who can understand what is how Maya would have decided, in this
Mm-hmm.
situation, who can understand her better. Everybody will be a part of that best interest meeting,
Right.
and then they're going to come to some conclusion, and
Mm.
that particular form will be signed by everybody, that okay, we are in agreement with this, that okay, this is how we are going to manage Maya Thompson, that she's going to sign. That is the best interest meeting output, whatever we are going to have.
Who signs the form? Everyone signs the form. Everyone who attends signs the form.
Yes,
Okay.
everybody. So witnesses, basically, the witnesses who were a part of the best
Mm,
interest meeting would sign that. In case after this best interest meeting, if she has any disagreement towards the decision they have made, then she could approach the court, and the court would send a court appointed deputy, and the deputy would make the decision on behalf of Maya Thompson. It's never the daughter.
mm. So if that's only if the daughter disagrees.
Yes, otherwise it's the MDT, the best interest meeting. They are gonna decide. And
Mm,
when she kept asking you that could it be a cancer, you rightly said that until unless we examine the patient and run a couple of tests, we can't understand that whether she has the cancer or not. And the chance of that happening is around 10 out of 100 women, which you rightly said. So, but do not concentrate much on the cancer. It could be simple
mm.
atrophic vaginitis as well. So it could be because of hormonal changes, and due to the
Oh my
friction, she
God.
can have the bleeding, or it
Mm,
could be some growths, that is polyp arising from the neck
mm,
of the womb, or it could be a cancer from the neck of the womb altogether.
mm.
It's not just the endometrium.
Yeah, yeah, yeah,
And
yeah,
it could be
definitely.
anything. So just say that. So we have got a variety of causes. It could be anything. It can range from here to there. So it could be as simple as, the atrophic vaginitis. We can treat it
Mm,
locally. Or it could be, on the other hand, a cancer which needs a detailed evaluation and,
mm,
surgery, an extensive surgery. So we'll
mm.
keep you in the loop. We'll call you back for the best interest meeting. And at this point of time, we are going to give some medications to Maya to control her bleeding. So once we have the best interest meeting, we are going to decide. First, we need to do an examination under anesthesia,
Oh,
which we are going to do some ultrasound to understand the thickness of the inner lining of the womb.
but before the best interest meeting, how will she be under anesthesia? Who's going to consent then?
We are not going to do anything. That's what I'm saying. We
Oh,
need
okay,
to
okay,
have
okay, okay. I
a
get you. I
patient.
get you. Sorry, I
Yes.
get you. Okay, fine. Yeah.
So now we'll just control her bleeding symptomatically,
Mm-hmm.
because even examination under anesthesia would require her consent, isn't it?
Mm,
So we can't do that.
mm,
All right.
yeah.
And there's one more task which I want you to do, Dr. Chido, at this point of time,
Mm-hmm.
as far as the Mental Capacity Act is concerned. There's this famous recall where the senior care worker would come to you for the consultation today, asking for permanent sterilization for a patient. Say, for example, Anna. She's 19 years old, who has Down syndrome with some learning difficulties. Okay.
Mm-hmm.
Now he has come to you and asking for permanent sterilization because he thinks that she is a child, she doesn't understand anything, she understands only the basic needs, she does not understand the sex or the consequences of it if she becomes pregnant, because she spends some unsupervised time with some male residents of the care home, and if she becomes pregnant and the consequences and things like that. So he wants the best for this for Anna, and he is here. And now Anna has not come. Why Anna has not come? Are there any safeguarding concerns here? We do understand that Anna has Down syndrome, does not mean
Mm,
that she can't make the decision. The
exactly.
decision is always decision. It's about decision specific. It's about the contraception. We need to understand whether she can make the decision as far as
Mm,
the contraception is concerned, and it's time specific. So
mm,
even if she does not understand, we'll involve the learning difficulty, nurse who can
mm,
communicate with her, some sign language we can use, we can make her understand, we can involve some psychologist or counselor, and then we will
mm.
come to a decision. And we can offer her some other methods like long-acting reversible contraceptives. Sterilization is something we need a court order. Even the best interest meeting can't decide that. Okay?
Mm-hmm.
I'm going to discuss this task somewhere. I mean, I think in this week or coming week in the group.
In the group,
Yeah, in the
okay.
group. Okay. Yeah.
Mm-hmm.
Are we clear? So